Hello and welcome back. My name's today Mr. Abbas Glory. So I want to first welcome you back to this channel, and if you are new, kindly hit the notification button and the subscription button. Okay, so back to the question we have. The question says the nurse is caring for a client with suspected sepsis. After reviewing the client vital signs, which prescription by the primary healthcare provider should the nurse administer first? The nurse is caring for a client with suspected sepsis. After reviewing the client vital sign, which prescription by the primary healthcare provider should the nurse administer first? See the image below. Now, what are the image below? We have the prescription and then we have the vital sign. What's the prescription number one? We have cetrazone 1 gram IV. We have 500 ml 0.9 saline. We have paracetamol. We have doxycycline. Okay, so these are the prescriptions that have been ordered. These are prescriptions that the nurse is expected to administer to the patient. Now, what are the signs and symptoms presented by the patient? Number one, we have pulse, which is 135. 2, we have respiration of 24. Now we have blood pressure of 90/60 millimeter mercury, and then we have oxygen saturation of 95. What is the question again? The patient is with suspected sepsis. Now, all of these medications are prescribed. What are they again? Cetrazone. We have paracetamol, normal saline, or rather we have saline, which is 0.9, 500 ml. We have acetaminophen, which is paracetamol, and we have doxycycline. The question we're going to ask ourselves is, what is the problem this patient is having? What is the problem? The question says the patient is having suspected, not concluded, but it's assuming is having suspected sepsis. If the patient is having sepsis, which is suspected, is now coming with sign and symptom of pulse 135, respiration 24, blood pressure 90/60, temperature 39, oxygen 95. So the question we're going to ask ourselves, among all of these signs and symptoms, which of them are normal, which of them are abnormal? Of course, we know oxygen level 95 is going down, but is not an emergency right here, right now. So we can remove oxygen level out of it. Pulse of 24. Pulse of 24 is on a high normal, but we can also remove it because it's not an emergency. So pulse, respiration of 24 is out of it. Oxygen saturation of 95 is out of it. So the emergency we have is between pulse of 135, blood pressure of 90/60, and temperature of 39. So the two things that are out of the way is respiration of 24 and the oxygen saturation, which is SpO2 of 95. So the three major things we have is pulse, blood pressure, and temperature. The patient is having suspected sepsis. Now, which of the following medications should be given to a patient who's having pulse rate, high pulse rate, temperature hike, and then low blood pressure? Should we go for gentamicin? Should we go for cetrazone, which is an antibiotic? Yes, the patient is having septicemia. Should we give antibiotics, cetrazone, and doxycycline as the first line of treatment? Should we give that? Let's hold on. Yes, we can give doxycycline and cetrazone. Those are antibiotics to treat sepsis. But should that be the first thing we do first? Let's hold on. Number 2, give paracetamol. Why paracetamol? Paracetamol will treat hyperthermia. But the question is this: what is the normal temperature? We were told that normal temperature is between 36.5 to 37.5. Somebody is now coming with 39 as against 37.5. So temperature of 39, should it be the first thing we attend to first for somebody who having suspected septicemia or sepsis? Let's hold on. Next, administer saline 500 0.9. Why should we administer saline? Now, in question like this, it comes with a lot. Every option is correct. Giving paracetamol is very correct. Giving antibiotics is very correct, because three major things that we need to address now is we have pulse, which is high, we have temperature, which is high, and we have blood pressure, which is low. In a question like this, any of these options is correct. However, how do we know which of them should we use first? When it comes to a question like this, the first thing you're going to ask yourself is, the first rule that is applicable when you are faced with options that look confusing is to apply the ABC rule of life. Apply the ABC rule of life. What is ABC? We have airway, breathing, circulation. Airway, breathing, circulation. Now, if you look at the question, does the patient have airway problem? The answer is no. Does the patient have breathing problem? From the option, the answer is no. Does the patient have circulation problem? The answer is yes. Because blood pressure of 90/60 shows that there is a circulation problem. Pulse rate of 135 shows that there is a circulating problem. Why? Because of the fact that the blood pressure is low. The heart want to compensate. That's the reason why pulse is increasing. So, how do we manage him? The first line of treatment is to give IV fluid. Give IV fluid. Now, let's think about it. As part of fever management, is you give fluid, give oral fluid or give IV fluid. Why you give oral IV fluid? Is to help to reduce body temperature. So IV fluid become the first line of choice, because low blood pressure will lead to hypoperfusion of body tissues. And when there is hypoperfusion of body tissues, organ failure will occur, which is most critical. Organ failure is close. So the best way is to address the situation that will reduce organ failure. How do you reduce organ failure? Start resuscitating the patient with fluid. When you administer fluid, blood pressure will increase, pulse will drop, temperature will reduce. I repeat myself, when you administer IV fluid, especially 0.9 saline, blood pressure of 90/60 will increase. Heart rate that is trying to compensate so as to meet up with the demand of body tissues will drop. Why? Low blood pressure will lead to increased heart rate. High blood pressure will lead to reduced pulse rate. So, as you administer the fluid and the blood pressure is rising, pulse will automatically start dropping. High fever will automatically still goes down. It's after you've done this, the next thing is to administer antibiotics. Why? Antibiotics will take care of the sepsis. But treatment of the sepsis is not the first line of defense. Why? Hypoperfusion is already occurring. So we need to address hypoperfusion first. So the answer to the question is to administer 500 ml of 0.9 saline IV. That is the first line of defense, so as to correct hypovolemic shock that the body is going into already. So do you find this voice note or this video useful? Why don't you hit the notification button and subscribe, as we expect more content. Thank you. My name is Mr. Abbas Glory. Thank you.